Thanks to Martin, and thanks for the organizers for the opportunity to present some of our recent research on our modern oral nicotine pouch products, VELO. So let's see, here we have a clicker, excellent. And I'm Elaine Round, and I'm happy to be here to represent VAT. But first, before I dive into the science, I just wanted to, or at least some of the details of the modern oral science, I wanted to talk a little bit about the importance of science at BAT. And BAT's mission is to create a better tomorrow, and to do that using a vision of building a smokeless world. And to be able to build a smokeless world, we need to have a range of products that are compelling for adult smokers to want to switch to those products. That's a multi-category approach. That's heated products, that's vaping products, and that's the nicotine pouch products that I'll tell you a little bit more about today. So science is key to that mission and that vision. And it contributes to that in 4 specific ways that I've got on this slide here. One is that it directly contributes to product development and innovation. It is foundational to all of our product stewardship that we do, to make sure that that the products that go to market have been evaluated and have had a robust toxicological evaluation to ensure that those are the right products going to market, and also to ensure that the device safety and compliance is strictly adhered to as well in cases of heated products and vaping products. It obviously underpins the scientific evaluation of the reduced risk potential of our products. And in addition, we use that science collaboratively with external engagement and being able to contribute to product standards. So this is the 9-step framework for reduced risk product evaluation, scientific evaluation that we use to determine the reduced risk potential of our products. And it's a weight of evidence approach. So it's really kind of a holistic approach of looking at all of the science to determine the reduced risk potential. And it's divided into 3 different categories. So one is emissions, and that's really about the chemistry of the product and the qualities of the product itself. That is looking at the chemistry of the toxicants. It's also looking at the toxicology, the in vitro biology, some of which I'm going to tell you about today for nicotine pouches. And then the next category is the exposure category. And that takes into account not only what people are exposed to, but their use behavior in how they're exposed to it, essentially. So how they use the product and the chemicals that they're exposed to when they're using the product. That takes the form of looking at nicotine exposure and things like nicotine pharmacokinetic studies and pharmacodynamic studies. And it also, we also look at things like biomarkers of exposure, biomarkers of potential harm as well. And that leads into the risk category. So those biomarkers of potential harm are proxies for looking at individual health risks. We also look at post-market surveillance, so looking at what's happening in the marketplace when the products are out there to understand population risk, and then also doing some epidemiological modeling to understand the potential health impacts to the population with the products being available. And of course, all that then leading to what things will look like over time as we continue to develop more and more science, and really ideally then having the epidemiological data to show the proof in the pudding that these products truly are reduced risk and reduced harm. So I'm going to jump into now a little more of the detail around some of the nicotine pouch product science that we've been doing over the last few years. So we've had 3 recent publications that are looking at kind of our in vitro biology assessments of VELO and relating that to combustible cigarettes and relating that to reference snus products as well. So in the first publication a few years ago, was really about developing the methodology that looked at identifying extracts that could be used to compare to extracts of cigarette smoke, for example, and reference snus products. The results of that, and then using those validated extracts in order to look at put into initial assays such as neutral red assay for cytotoxicity and real-time cell analysis to kind of start to understand what the toxicological impacts were relative to the different product categories. And those results support that the oral nicotine pouch category in general, and VELO specifically, was less cytotoxic and had less genotoxic potential relative to cigarettes. And then in the second of the series of studies, we used real-time cell analysis, but then expanded the VELO products that were in those studies to include multiple flavors, so 8 different flavors and 3 different nicotine levels. Excuse me. To understand the kind of in vitro toxicological biology around what happens with different flavors and nicotine levels. And there we saw that there was not a difference, and that all of those had the same low potential, risk potential. And that was relative to the snus reference product. And then in the last study, which is the one that we published this year, we looked at the contemporary toxicology studies that were used in those first 2 studies. So real-time cell analysis, tox tracker that looked at different biological biomarkers on things like oxidative stress, cell stress, DNA damage, and then brought in some of the classical toxicology assays, including the Ames assay, the mouse lymphoma assay as well, and also bringing in neutral red assay for cytotoxicity. So the whole collection, and looking at those, there we looked at 3 flavors and 3 nicotine levels relative to the snus reference product, and showed minimal responses for those assays across the board, again adding to that reduced risk potential of the VELO nicotine pouches. So just to put this in context, and this slide really just shows the relationship to cigarette smoke. But some earlier work we did on the chemistry of the VELO nicotine pouches relative to combustible cigarettes shows that looking at top reg 9 constituents, 99% less constituents, so reduced toxicants. And then the summary of the toxicity measures specifically cell stress here, cytotoxicity, and genotoxicity being reduced 98% or more relative to combustible cigarettes. And then in the last few minutes, I'll just touch on a cross-sectional study that we had completed a couple of years ago, which looked at VELO users compared to smokers and former smokers and never smokers. So we conducted this study in Sweden and Denmark, and we basically looked at a number of different biomarkers of potential harm, a number of different biomarkers of exposure, and a few other biological endpoints and quality of life survey as well. The primary objectives were essentially biomarkers of many of the biomarkers of potential harm, 1 biomarker of exposure. Secondary objectives kind of flipped more of the biomarkers of exposure, 1 potential harm biomarker, and then some of those other endpoints that I had mentioned earlier. And I didn't think I would have time to actually present the results, but overall, the summary of the results showed that all of the biomarkers of exposure were significantly reduced relative to the cigarette smoking group, and all were in line with what you see with former smokers and never smokers. And for the biomarkers of potential harm, 3 of those biomarkers were significantly were favorable and statistically significant in the favorable direction. And then 4 of those were directionally where we would expect them to be, although not statistically significant. But importantly, they were all in line with what we saw from the former and never smoker groups. So putting that all in context for VELO, we've seen the toxicants were reduced 99% relative to combustible cigarettes. The toxicology, based on all of the different various assays and studies that we've done collectively to date, show 98% or more reduction in risk potential relative to combustible cigarettes. We saw significant reductions in biomarkers of exposure and biomarkers of potential harm in some instances, and all of those, importantly, were in line with former and never smokers as well. And then very important part of the science that we do at BAT is to ensure that we're publishing all of our work. And to date, the VELO publications are over 20 peer-reviewed publications to date. So thank you very much.